listening to the Agent Survival Guide podcast, a podcast for today's insurance agents. Informing, educating, empowering, improving the way you do business in an industry that's anything but static. In today's episode, we've compiled a list of frequently asked questions regarding compliant marketing for your insurance business. FAQs and guidelines on compliant Medicare marketing materials. Insurance companies and agents are tasked with remaining compliant with the Centers for Medicare and Medicaid Services, CMS, while marketing their services. That makes sense on the surface, but the details may need some clarifying. You may be brainstorming the best Medicare Advantage marketing ideas, but when getting creative with materials, agents must be mindful of how we're representing ourselves. The Medicare Advantage and Part D communication requirements and CMS Medicare marketing guidelines exist to protect both consumers and agents. Over the last several years, CMS has introduced and refined new rules, including defining agents and brokers as third-party marketing organizations, or TPMOs for short. As a TPMO, you need to follow certain rules, like adding disclaimers to your materials. We've put together a few common compliance questions and answers to help you navigate CMS Medicare marketing guidelines for agents. What's required of agents before engaging in Medicare marketing or sales? CMS states that only agents who are licensed, certified, or registered under state law are permitted to market an insurance company's Medicare Advantage or prescription drug plans. Agents are also required to complete the insurance company's annual mandatory certification processes for the carriers they wish to represent. Only after an agent is trained and certified to understand the rules, regulations, and specific Medicare product details can a carrier confirm an agent's ready-to-sell status. Medicare Advantage organizations, Part D sponsors, agents, and other TPMOs must submit materials that market any Medicare Advantage, Part D, or cost plan benefits, including but not limited to widely available benefits such as dental, vision, and hearing, premium reduction, and cost savings to CMS for approval before use. What's required of an agent to become certified? For each carrier an agent plans to market, the agent must complete that company's annual certification process. It's important to check with each company's specific requirements, as processes may vary. Each company may also have a different notification method to inform an agent that they're ready to sell, so checking on their specified system for confirmation is best. Ritter's Certification Center can help to navigate some of these companies' requirements. You can find a link to the Certification Center in our episode notes. How can I easily record calls with my Medicare clients? You can record calls by using Integrity Connect, an easy and no-cost answer to securely recording, storing, and downloading both outbound and inbound meeting notes. For more information, check out the Ritter blog's post, FAQs about the Medicare call recording requirements. That'll be linked in the notes. How do I keep my marketing materials compliant with the TPMO requirements? Agents must add the TPMO disclaimer when communicating with a beneficiary through email, online chat, or other electronic means of communication to their website, in any marketing materials, including print materials and TV ads, and within the first minute of a sales call. The disclaimer must be specific to the beneficiary's service area. If marketing fewer than all plans within a service area, use
quote, "We do not offer every plan available in your area. Currently, we represent X number of organizations which offer X number of products in your area. Please contact Medicare.gov, 1-800-Medicare, or your local state health insurance program, SHIP, to get information on all of your options." End quote. If marketing all plans within a service area, use, quote, "Currently, we represent X number of organizations which offer X number of products in your area. You can always contact Medicare.gov, 1-800-Medicare, or your local state health insurance program, SHIP, for help with plan choices." End quote. You must also provide the disclaimer when communicating electronically with a beneficiary through email, online chat, or other means of communication. On my website, can I reference a Medicare Advantage plan's marketing materials and the trademarks of the companies I represent? No. Agents cannot reference specific prescription drug plans or Medicare Advantage marketing on materials or use an insurance company's trademark on their site. When a plan-specific or company-specific reference is used regarding a Medicare plan, it's considered that company's marketing material. It's like forging a signature or fabricating a quote. If it wasn't approved or provided by the company, it's not okay to use it. If an agent wants to reference any Medicare Advantage plan information or the insurance company logo on their website, the agent must work with the specific insurance company to obtain their prior approval and properly file with CMS if necessary. Can I reference Medicare Advantage or prescription drug plan info on direct mail marketing material? No, for the same reasons we specified in our answer to the previous question. Anytime a plan-specific reference is made on marketing materials, it's considered that company's materials. CMS does allow brand promotion, but not specific product references, and prior approval of using that carrier's logo or name is required. It is possible, though, to use a specific company's pre-approved marketing materials. Note that generic direct mail materials without any benefit, plan, or company-specific information do not require prior approval, provided all other marketing guidelines are met and such material does not meet the definition of marketing material. Can I post about my insurance business on social media? A social media strategy is a great way to connect with current and potential clients in the digital era. Remember that making unsolicited contact with individuals is not allowed. Clients must initiate contact, and you must collect permission to contact or a scope of appointment if you plan to discuss plan information. Additionally, if you plan to post plan-specific information, this must also be filed with CMS, approved and opted in by the specific carriers. Are there specific elements I must include on my Medicare-related email newsletter? If you plan to send emails, you must include a way for recipients to opt out of future communications from you. Many newsletter building sites have this tool available, such as the Safe Unsubscribe feature from Constant Contact. When should I avoid using Medicare on my marketing materials? According to Section 1140 of the Social Security Act, it is forbidden to use the words or symbols, including Medicare, Centers for Medicare and Medicaid Services, Department of Health and Human Services, or Health and Human Services, in a way that would indicate the approval, endorsement, or authorization of Medicare or any other government agency. Never represent your business as one that is from Medicare or working for Medicare. Do not use the CMS logo. Avoid using the word Medicare in a manner that suggests Medicare employs you. This includes terms like Medicare expert, Medicare specialist, or Medicare agent on your business card. It's important to be clear about your role and not mislead clients into thinking you're affiliated with the federal government. Using these terms can create confusion and misrepresentation. Instead, accurately describe your services without implying a direct connection to Medicare. Opt for a more generic title, like licensed health insurance agent, on your business card, and consider adding a tagline that helps describe your services further. For example, over 65, let's find the best coverage for you. In addition to your marketing materials, CMS prohibits the use of Medicare in your business name, logo, or website URL if used in a misleading way, one that would cause potential enrollees or beneficiaries confusion over whether you're affiliated with Medicare. Can I market certain plans as the best? No. CMS prohibits the use of superlatives in most marketing unless you can back it up with factual data that supports the usage and meets CMS requirements. Do I have to tailor my marketing materials for certain service areas? Yes. CMS prohibits marketing of benefits where they are not available unless it's unavoidable due to the nature of the marketing. An example of an unavoidable situation is a TV ad picked up by an adjacent market. Remember this rule especially when marketing 5-star plans, special needs plans, and Part B give back benefits. It is best to coordinate with the carriers that offer these plans in the service areas, as such materials will require carrier prior approval and submission to CMS before they can be used. Do I have to include carriers' names on my marketing for their plans? Yes. If marketing plan-specific benefits in print ads, agents must include the names of the Medicare Advantage organization or Part D sponsors in 12-point font. The names cannot be in a disclaimer. For radio or other advertisements that are voice-based only, the names must be read at the same speed as the phone number. This rule applies to marketing and communication material content and will require HPMS submission and carrier opt-in if applicable. Can I promote general savings a client could receive on a plan? No. Agents cannot market generalized savings when the actual savings are specific to the individual. Keep this rule in mind when marketing dual-eligible special needs plans and when working with third parties for lead generation. Where can I get compliant marketing materials? Many carriers and field marketing organizations offer compliant marketing materials for agents. Check out shopritterim.com for CMS-approved business reply cards, Medicare educational event materials, promotional tchotchkes, and more. Now, an important note for using Shop Ritter IM, agents must register with Ritter and have at least one active contract through Ritter Insurance Marketing to purchase marketing materials on shopritterim.com. Orders will be rejected if both of those requirements are not met. And quick note, if you are a newly registered agent, you must speak with your Ritter sales specialist to unlock Contract Now in the platform. If you use Plan Enroll, Integrity's consumer-facing enrollment platform, and become a Plan Enroll network agent, then you have access to a variety of marketing materials to use with clients, including direct mail, email, landing pages, and social media. These materials are customized with your contact information and boost traffic to your agent-personalized website. Marketing compliantly can seem challenging, but it is always better for everyone involved to follow the rules and regulations in place. We strive to make compliance less stressful with episodes like this one and other resources. To learn more about keeping your marketing materials and practices compliant, please see the Ritter blog posts about Medicare Advantage and Part D communication requirements and our do's and don'ts of Medicare compliance, all of which will be linked in the episode notes. And don't forget, you can always reach out to us with any questions. Send us an email at asgpodcast@ritterim.com. We love hearing from you. Thank you for listening. We will see you next episode. The Agent Survival Guide podcast is a production of Ritter Insurance Marketing, an integrity company. Script adaptation by Tina Lamoureux. Recording and production by me, Sarah Ruppel. Podcast design by Urban Rivera. Like what you hear? Follow along with our show wherever you get your podcasts. Rate and review our show on Apple or Spotify.